The famous Dr. Derek Shepherd said, "It is a beautiful day to save lives," and I feel like nurses have a big part in that too. I've heard it said that nurses are the backbone of the healthcare industry. Leo Buscaglia said, "Too often we underestimate the power of a touch, smile, a kind word, a listening ear, an honest compliment, or the smallest act of caring, all of which have the potential to turn a life around." There's always going to be job security. You're never going to be able to not find a job as a nurse. There's flexibility. You can work all the different hours. There's different set schedules. You can work in a hospital or you can work in a doctor's clinic. The benefits and rewards there, it's so much more than just having great health insurance. It's the emotional benefits and rewards too. Being an advocate for the patient, saving lives by being an advocate for the patient is so important. It's probably the thing that's been drilled into me the most. You're the patient's advocate. You are going to be able to speak for the patient, knowing what they want, and you're able to get things done that they may not know how to get done. Tariq El Moussa is, he's a guy that was on HGTV, and he and his wife had a remodeling show, and a nurse wrote into his producers and said, "You've got to have him go check his throat out at the doctor. He has a thyroid tumor." And sure enough, he went and got it checked out. He had stage 2 thyroid cancer, but he was able to get it removed and everything's fine now. But a nurse was the one that told him that because she was watching the show. Maya Angelou said, "They may forget your name, but they will never forget how you made them feel." Saving lives by doing more than what's expected is par for the course for a nurse. Mother Teresa said, "I see God in every human being. When I wash the leper's wounds, I feel I am nursing the Lord himself." And there's so much more than what is expected that is done every day by nurses. There's a nurse I heard of that walked 2 miles in a blizzard in the Bronx to get to the hospital she worked at, and she was the only nurse that showed up that day. And all of the patients that were admitted, all of the patients that she saw that day would not have had a nurse to have that communication with. Saving lives by knowing the system and how specific doctors do things is so important. I heard a story about a nurse who, her patient was dying. She had gotten this patient and his blood pressure was way down, and she looked at the charts and looked at what all had been done, and the nurse, whoever had put it in, had put the wrong size needle in for his medication, and he was getting 10 times the amount of narcotics needed for his weight and size, and it was killing the patient. She was able to change that out, and the patient was able to live, but they weren't able to figure out what the problem was before she looked at all of the chart and how everything was done. Also, if you work day to day with a doctor and you know it with these symptoms and this specific test is normally ordered, and the nurse looks on the order and notices that test has not been ordered, he or she is able to talk to the doctor and find out if that was an oversight, or if it was just a missed box, or if it was intentional. And this can absolutely save lives. No matter what field you delve into, what specialty you choose, you can always go into other ones. You may like NICU at the beginning and get bored or get burnt out and decide you want to do oncology, or be depressed after working on oncology end of life care for a certain amount of time, and you may want to go do something completely different, trauma or something. There's always endless possibilities for switching specialties. And also you can switch up your schedule. If you work better at night, or if you get tired at a certain amount of time, you can always change your schedule around. The need for nurses is not diminishing. In fact, it is growing. Reuters published an article saying that hiring a nurse is better than closing a bed. And according to the American Nurse Association, by 2022 there will be a need for 3.44 million nurses. People will always remember the good and bad experiences that they have during their hospital stay. And I specifically remember this. A very dear friend had all of the nurses, every nurse that came to her room, they made a big impact on her. And my grandma just loved her nurses when she was in the hospital. And they become allies and friends to the patients. One nurse said, "I get to advocate for people who are at their weakest." Christina Feist, who is a nurse, said, "Every nurse was drawn to nursing because of a desire to care, to serve, or to help. Nurses provide a sense of support, which is very rewarding when you are able to either release a patient or give comfort to a family over the loss. Nurses are in a unique position that allows them to integrate all aspects of patient care, ensuring that concerns are addressed, standards are upheld, and positive outcomes remain the goal." Being a nurse is freaking awesome. You just can't go into a better field, in my opinion. Nurses are the line of communication between the patients and the doctor. There are so many possibilities for professions as a nurse, and the benefits are really nice. If you have a heart to give back or want to help people, being a nurse is a very rewarding field. Thank you.